Are we doctors? We would go through introduction, we observe the bedside, and then we also observe the patient. Yeah. So hi, my name is Sheila. I'm a third year medical student from University of Toronto. Can I get your name and date of birth, please?
Sana Majapo, 3rd of January 2002.
Good. So my supervisor has asked me to perform a peripheral exam on you. This will involve you being exposed, just this part of your tummy, feeling up all the pulses. Do I have your consent?
Yes.
Okay. So my supervisor is likely to repeat the examination since I'm a medical student. Okay, so that was the introduction. I am going to now observe my environment. So when I look at my environment, there is no medication, there are no Zimmer frames, and there are no wheelchairs. When I look at the patient looks well. They don't have any discoloration and they don't look like they're in pain. Okay, are you in any pain? No. Okay, so I'm going to begin. I'm going to wash my hands. So when you look at their hands, there are no ulcers, there's no gangrene, and we're going to measure the capillary refill time. This is when you squeeze and then you wait for 2 seconds, and they have to refill within 2 seconds. So we're going to do that. So the capillary refill time is less than 2 seconds. When we look at the arms, we're looking for discoloration, temperature, and hair distribution. So the temperature, equally warm on both sides, and then there's hair distribution, equal on both sides, and there's no discoloration, there's no scarring, yeah. So we're going to check for the radial pulse, we're going to check for the rate, the rhythm, the volume, and the character. So I'm going to look at the clock for 15 seconds and observe her pulse. Okay, let's say it's been 15 seconds. So the rate and the rhythm are normal. And no, the rate and the rhythm are regular and the character or volume are normal. Okay, so we have to do the other side as well. So we're comparing both pulses to see if there's any radial delay. So there's no radial delay. Okay, so at this point you measure blood pressure, but we're not going to do it today. Could you please expose yourself from your abdominal? Yeah. Can you please lie down? Okay, so observing her abdominal, there is no visible scarring and there is no visible pulses. So I'm going to palpate her aorta for any abnormalities. So there is no abnormalities when I've palpated her aorta. I'm going to listen to her aorta for any bruits. So there's no signs of any bruits in her aorta. Move on to the legs now. So can you please expose your legs? All the way? Yeah. So for the legs, we're going to look for any discoloration, any temperature abnormalities, and we're also going to check the capillary refill time and any scarring. So when I look at her legs, there's no scarring. There's even hair distribution on both sides, and when I look at her toes, there's no gangrene. So I'm going to do her capillary refill time. This is when you squeeze both toes and then you wait for 2 seconds. So squeeze. So her capillary refill time is less than 2 seconds. Okay, there's also no signs of discoloration on both legs. We're going to check her pulse. We're going to do the one here first, which is the popliteal artery. So if you just bend your please. Okay. So this one is a bit difficult to find, so make sure you take your time and use both hands. Okay, so the rate and the rhythm are regular. Okay, get on both sides. Please extend for me, please. So the rate and the rhythm are regular as well. Okay, so we don't usually do the femoral, you just mention it. So the femoral is right here, in the pubic area. Posterior tibial. Yeah. Posterior tibial is right here. Okay, so you comment on the rate and the rhythm. So the rate and the rhythm are regular. And then you do it for the other side as well, posterior tibial. So the rate and the rhythm are regular as well. Dorsalis pedi, which is right here. So you comment on the rate and the rhythm. So the rate and rhythm are normal. And you do the other side as well. The rate and the rhythm are normal too. So if you do blood pressure, you do have to check the brachial artery, which is right here, on the patient, and then you have to also comment on the rate and the rhythm. So usually if you are allowed to check the femoral artery, you also take the femoral artery, so you listen to it. Thank the patient. So thank you so much for letting me do this examination. I'll report my findings back to the supervisor. For additional tests, I will do cardiovascular examination. Thank you very much. Now it's the end. I'm gonna wash my hands.